Good evening, all. I'm so delighted and happy to have Dr. Ranjit Singh, Vice Chancellor of Shobhit University. He's a renowned academician, administrator, presently working as Vice Chancellor. So, welcome, sir, to this international interactive session platform, live meetup of questions. Welcome you, sir.
Thank you very much. Namaskar.
Okay, actually, now pharmacy is on the demanding side because everywhere the pharmaceutical industries are coming up. So, sir, what will be the future scope of pharmaceutical industry and pharmacy as a career in India?
Thank you. This is very pertinent question, and let me tell you that pharmacy was having huge scope in the past also, and with all the prevailing condition, all changed scenario, especially in view of if we talk of COVID-19, the scope has immensely increased. Whether we speak of pharmaceutical industry or otherwise other services or the products, so we see tremendous progress, and pharmaceutical market is enhancing, increasing in its size, like anything which is expected to be around $65 billion US dollars in 2024, and by 2030 it will be around $130 billion. And our country is being looked as pharmacy of the world, and we have proven this during COVID. And also to tell you that we are the the top exporters and the top among the list of the top exporters of generic drugs and vaccines to the world at very affordable prices. That is the point, actually. Yeah.
Yes, sir. So, choosing pharmacy as a career after the plus two, like B Farm, then going for higher studies. But no, the preference is like that. Most of the students are planning or interested to do the studies in abroad because considering the scope also in pharmacy, like how can you make a comparison like the pharmacist in India and the pharmacist outside India?
Yeah. Pharmacy, as far as the quality of education is concerned, we have improved a lot. There is no doubt in that. Yes, many of the aspirants, they prefer to go abroad for education and particularly for job. The reason is that in Western countries or other countries, even pharmacy is considered number one profession, and it is the highly paid profession. That is the one reason to go there. But conditions had improved, over the time. I joined pharmacy in 1985, and for my B.Pharm studies, completed my undergraduate in 1989, and then obviously in 1997 I did my PhD. And if I see for last these 26, 27 years, I have seen a lot of changes. It was the time when I joined pharmacy, nobody was knowing what V pharmacy is. And now there are a huge number of colleges across the India. Some of them are doing, wonderful in providing quality education. Some premier institutions from where I studied, from Sagar, for example, and others, which are premier institutions. So some of the persons, they prefer to go to abroad for education, but mostly for job because it is highest paid job in Western countries.
So now we are entering into the new education policy. So how it can be blended as a vice chancellor of the renowned university, how it can be blended with like technical education, pharmacy, and other allied branches.
Yes, actually, we can say that pharmacy, if you study the structure of pharmacy, pharmacy core program in a way, it includes everything, because in National Education Policy 2020 was talking about multidisciplinary education. That is one part. And you see, if you see pharmacy curriculum, we study engineering, we study law, we study management. Chemistry is, of course, core. And then there are other subjects like anatomy, physiology. So it is a combination of almost all subjects. So it is having multidisciplinary approach right from the beginning. Now, with changed scenario, I think one thing I would like to mention here, that is called MEME, multiple entry, multiple exit. If you see the current structure, we are offering diploma, 2-year diploma course, 4-year degree course. Then we have 2 years PG courses in different branches. PhD is there. PharmD is introduced by Pharmacy Council of India a few years ago. So these courses are being offered, but the new structure, which obviously Pharmacy Council of India, which is responsible for the design of curriculum, rules and regulations. They are incorporating in the syllabi how a student, if you want to leave after 1 year, maybe with a certificate course, after 2 years with diploma, and all 4 years with degree. So that thing will be incorporated into the curricular aspects, and it will be implemented soon. Right now, we are following the old syllabus, but it will be changed. And we can see one more thing is emphasized in national education policy, and the national credit framework, which was given by UGC, that along with lecture, tutorial, and practical, which is an intrinsic part of any curriculum design, experiential training, that is E part, L, T, P, and E, is being emphasized. In pharmacy, our curriculum is so that we have theory and practical to the equal extent. 50%. We look into the practical aspects more. So we give the student training how, particularly how the drugs are synthesized, how formulations are manufactured. So we are already into that experiential training or learning, but with changed scenario, when NEP will be implemented in toto, we will find some more changes in the curriculum, and obviously the quality of education will improve.
It's a wonderful explanation, a very good aspect. So now we know that emerging technologies like artificial intelligence, machine learning in medical field also, like in the case of robotic surgeries, then scanning an image, like determination of a tumor cells, all these things are happening. Like the dominance of technology is coming. So how technology, the emerging technology can be blended with pharmacy? Any add-on
Yes.
programs like that?
Yeah, this is an era when, if you speak of third decade of 21st of first century, then it is an era of skills and disrupting technologies. As you mentioned, they are playing a very important role. We talk of AI, we talk of machine learning, we talk of robotics, and so many other things. In pharmacy, technology is being right from the beginning, but the acceptance of technology in pharmacy, there are two parts here. One is obviously education, and other is the industry part. And of course, hospital pharmacy, clinical pharmacies, there are pharmacovigilance, so many fields. But if I speak of education and industry, then obviously even in education sector, we are adopting technology very fast, and we are using technology in our teaching, day-to-day teaching, and we are not in a position to adopt everything, but yes, the pace is very good, and over next 2-3 years we will be using technology, what you call hybrid kind of education, where you will give instructions physically as well as virtually. In industry, these technologies are being used for enhanced production, there is no doubt in that, and doing certain things which do not need much skill, human intelligence where it's not needed. Robotics is being used in production. And if I talk of the services, that is community pharmacy, then we all know that even our country is doing very well, whether it is electronic health records or other things. You can see there are so many apps where after some time, our country is a country where around 80 crore of the people, they are using mobiles, Android mobiles, and this is a country is doing wonderfully well in adopting technology, particularly in the regime of this government. So technology is playing its role, but I must mention here that the role of human intelligence, that is the people connect, will be there, and it will remain all the time there. We are adopting technology, and there is no other way to adopt technology to enhance the productivity, whether it is education or industry.
So coming to the last question, I would like to add one thing. Like we would like say mathematics and physics are the foundation for engineering. Biology is the core for medicine. Actually, the fundamental, the basic science, physics, chemistry, maths, biology, all these are the fundamental things. So what is the base core for the foundation for pharmacy?
Yeah, see, pharmacy is mostly based on chemistry. We study all kind of chemistry, whether it is inorganic, organic, or physical chemistry. You see, pharmacy had four main specializations. One is pharmaceutics, which deals with the drug delivery system, which you see, we design them, tablet, capsule, suspensions, emulsions, like that. One is pharmaceutical chemistry, where drugs are synthesized, their structure is established. Then we have pharmacology, where we study effect of drugs on animals, that is preclinical, or on human beings, that is clinical, and then there is pharmacognosy, which is dealing with the drugs from plant origin, phytopharmaceutical. So there are basically four major branches of pharmacy, and these branches, they specifically deals with the discovery of drugs, their effect on animals and human beings. So this is how our curriculum is addressing almost everything, mostly based on chemistry. We study anatomy and physiology, that is biology side. We study mathematics, we study engineering, we study management. It is part and parcel of our curriculum. So pharmacy curriculum basically include almost all things. Major is of basically chemistry.
So thank you, sir, for your wonderful session and spending your valuable time for this international interactive forum. Because long back we were planning to schedule this interactive session, but due to the inconvenience or due to some mismatch, it was not happening. As you have mentioned, now only the chemistry matched, and right thing will happen at the right time. So thank you for spending your valuable time for this good evening. So thank you, sir.
Thank you very much. Thank you very much.
Thank you.
Namaskar.